All right, it's a couple of minutes after 1 o'clock, so I think we can get started. To better organize questions the HMIS Help Desk receives during the meeting, our team will recommend that you submit your questions through the Q&A option as shown above to the right, in between notes and more. We ask that you keep your questions general and related to the topics discussed in the meeting. Agency-specific questions are best supported through an OCHMIS Help Desk ticket submission, so our team is able to further investigate and provide assistance, especially if it includes client identifying information. During today's training, we'll be covering HMIS security best practices, client privacy best practices, using and disclosing client information, client consent to share protected personal information, client record privacy and sharing settings, client record request, HMIS grievance process, HMIS privacy and data ethics training survey, and Q&A. Amy?
Good afternoon, everyone. First up, we're going to cover HMIS security best practices. The Homeless Management Information System, or HMIS, is a secure database used to store client-protected personal information, or PPI, such as client names, dates of birth, and social security numbers. Orange County Clarity is an encrypted centralized database operated by Bitfocus. The OCHMIS team oversees its management in Orange County as the HMIS lead agency. HMIS complies with the Health Insurance Portability and Accountability Act, known as HIPAA, and the Violence Against Women and Department of Justice Reauthorization Act, or VAWA, and all federal, state, and local confidentiality laws. If you'd like more information about HMIS privacy, confidentiality, and security procedures, please review the OCHMIS policies procedures linked in the Google Doc, or navigate to ochmis.org, HMIS forms and documents, HMIS policy and privacy forms, and click on OCHMIS policies and procedures. Security best practices for HMIS participating agencies. To gain and maintain access to HMIS, agencies must adhere to the technical standards below for any equipment used to access HMIS. Virus protection software that is updated weekly, performs scans daily, and automatically updates to the most current version. Must have a firewall in place between any computer and internet connection for the entire network. A password-protected screensaver that locks within 5 minutes of inactivity. An operating system for Windows or Mac that is less than 5 years old. And all computer terminals used to access HMIS should be stored in a secure location. All users with access to HMIS must follow these security best practices to maintain their access. These practices are outlined in the user agreement and the OCHMIS policies and procedures. Users should never share their HMIS password with anyone for any reason. Users must lock their computer while stepping away. Any physical client files must be stored in a locked cabinet or office. And never disclose client PPI across an unencrypted network by email or text. And as a note, most public Wi-Fi is unencrypted, just like your local library or local Starbucks. However, users can send it via an encrypted or password-protected email on a work network or utilize the unique identifier. If you're not familiar with what a unique identifier is, it's the auto-assigned alphanumerical ID generated by Clarity during profile creation and can be found on the profile screen as seen here in the orange box. If you provide the UID to another HMIS user, they will be able to find the client record by searching up the UID. Users can also use the messaging system available within HMIS. Because HMIS Clarity is an encrypted platform, users can communicate using names, dates of birth, or social security numbers linked with the client. To learn more about the Clarity messaging system, you may review the Messaging Within HMIS Knowledge Base article. To gain access to HMIS, users at HMIS agencies must complete the required HMIS trainings for their access role type and sign the HMIS user agreement. More information about HMIS trainings are available from the New Staff Onboarding Knowledge Base article linked in the Google Doc. The HMIS user agreement outlines the user's responsibilities in protecting client data and upholding conformed consent. It must be signed during the user's first login to HMIS and renewed annually thereafter. Security best practices for agency administrators. Please note that these standards are reviewed during the annual HMIS agency audit, and our team at OC HMIS for the help desk is happy to help support AAs with following these guidelines. Ensure that all devices used by agency staff meet the security standards outlined in the OC HMIS policies and procedures. Escalate any security violations reported by HMIS users to the OC HMIS help desk via the data breach incident form. Maintain an agency-wide process for destroying client documents with PPI after the 7 years specified in HUD's privacy and security standards. Submit the HMIS account update and testing form to request account updates for any users who require a change in access role type or deactivation for users who no longer work for the agency. Agency administrators can also utilize the HMIS Dropbox folder for sharing any client PPI. Because Happy Fox, our ticketing system, is not an encrypted database, we do not allow any PPI to be attached to help desk tickets, including within screenshots. If you need to share reports or screenshots with client PPI, please use your agency Dropbox folder. If you're an agency administrator and you're unsure about how to access your agency Dropbox folder, you can review the How to Access Your Agency's Dropbox Folder knowledge base article linked in the Google Doc. HMIS data breaches. A data breach is the unauthorized access or sharing of client information that compromises the security, confidentiality, or integrity of data in HMIS. Data breaches could include, but are not limited to, HMIS users sharing an HMIS account and/or their passwords with others, sharing client identifying information with anyone that does not have access to HMIS, sharing client identifying information over an unencrypted network, leaving printed documents with client identifying information in an unsecure location. Any suspected data breaches must be reported to OC HMIS, and users who violate HMIS data security may be subject to immediate suspension or revocation of access to HMIS. If a data breach incident occurs, the agency administrator must notify OC HMIS using the Data Breach Incident Report form. The form is sent to the OC HMIS help desk automatically upon submission. To locate the HMIS Data Breach Incident form, go to ochmis.org, HMIS Forms and Documents, for agencies/projects currently set up in HMIS, and click on Data Breach Incident Report.
In our next section, we will cover client privacy best practices, including the use of HMIS client privacy forms for informed consent and the explanation of client rights regarding how their data is shared. When explaining client privacy rights during intake, please use the HMIS privacy forms to explain why we ask for client PPI, what rights clients have to the information that they share. Client privacy rights are outlined in the consent to share protected personal information, or PPI, privacy notice, client revocation of consent form, and HMIS grievance form. The privacy notice must be posted in all areas where HMIS data entry occurs, and for those conducting street outreach, having a few packages that include the client consent forms available is recommended, and having it accessible on the agency's website is also recommended. The privacy notice explains why we collect and share PPI, the type of PPI collected, how PPI is protected in HMIS, how PPI may be shared and disclosed, the explanation of why consent is needed, and client privacy rights. Agency administrators must monitor compliance with standards of confidentiality in data collection, entry, and retrieval outlined in the OC HMIS policies and procedures. Agency admins must ensure that staff use the privacy forms that contain the most recent version, date, revision date. Ensure that the privacy notice is visible in all areas where HMIS data entry occurs and is accessible on the agency's website. Ensure that staff keep accessible physical copies of the client consent, revocation of consent, and HMIS grievance forms. Please ensure that all HMIS users at the agency are able to clearly explain the purpose and benefit of HMIS and the related HMIS consent form to clients. All HMIS users must be able to clearly explain the purpose and benefit of HMIS and the related HMIS consent form as detailed in the client privacy section, such as what is HMIS, what personal identifying data will be collected and how it will be used, privacy and confidentiality standards, the revocation of consent, and how to do it. Ensure that clients have the opportunity to review and ask questions about each of the privacy forms during intake. Remind clients that they have the right to deny or revoke their consent at any time and that their decision to share PPI will not affect their ability to receive most services. Most services that do not include certain data for program eligibility. For example, a PSH project may require information about disabilities or another program. Amy?
Rachel, and using and disclosing client information. During this section, we'll review appropriate uses and disclosures of client information. Collecting client data can lead to questions about what information is entered into HMIS and how client information is used. Please reassure clients that information added to HMIS is protected by encryption and strict privacy measures. Client consent is not required to collect PPI and create a client record to serve the client. However, clients must sign the consent to share PPI in order for their PPI to be viewable by other HMIS participating agencies. The screenshots seen here are of the consent to share PPI form, highlighting the sections on how PPI may be shared and disclosed and what signing the consent entails. It is good practice to review and answer any questions the client may have about how their information may be used during the intake process. And as always, clients maintain the right to receive services even if they do not sign this consent. Remember, client consent is not needed to collect and create a record, but rather the clients are providing consent to share their PPI with other participating agencies. HMIS users should make the client aware that client PPI are collected and disclosed to prevent duplication of client records, coordinate care, and identify potential needs around disability or income capacity. Examples of PPI include client's name, contact information, social security numbers, dates of birth, basic demographic information such as age, race, and ethnicity, the client's history of homelessness and current housing status, and the client's self-reported medical history and disability status, as well as the client photo and veteran status. It is understandable that clients may feel hesitant or express concerns over why certain pieces of information are needed. Users can remind clients that these PPI are collected to prevent duplication of records and to coordinate care. It is difficult to coordinate care in an effective manner when there are several records that exist for the same client at various stages of enrollment and completeness and different accounts of the information. When using client data to coordinate care, it is also important not to inadvertently disclose client information in a manner that violates their privacy rights. Certain data may not be considered PPI on their own, but are considered PPI when combined. An example of an inadvertent PPI disclosure would be to send an unsecured message using the client's initial with their UID, such as FRBA with a unique identifier, or sending an unsecured message using the client's initials with their location. However, an example of appropriate communication would be to use the client ID with other non-PPI. For example, you can say unique identifier is at Palm Park. Or users can opt to send an encrypted or password protected over an encrypted network, or utilize the HMIS Clarity messaging system. Rachel?
Thank you, Amy. During this section, we'll cover the client consent to share PPI. The client consent to share protected personal information, or PPI, is required to share client data with other HMIS agencies via a shared public record. Agencies do not need a client to sign the consent to share protected personal information form to create and enter their PPI into a record. Clients who refuse to sign the consent to share protected personal information form can still be served by creating a private record. Similarly, any clients with an existing record can still be served after revoking their consent via an anonymized profile. Record privatization, anonymization, and consent settings will be covered in the next section. The consent to share protected personal information form is located on the OC HMIS website under HMIS Forms and Documents with the name HMIS Policy and Privacy Forms. Versions are available in English, Spanish, and Vietnamese. Clients should be offered the form in the language of their preference. Please note that these are updated on a quarterly basis. The client consent to share PPI form must be reviewed with clients at intake. This covers the right to receive services with or without signing the consent, the right to request a copy of their consent, and the right to revoke their consent at any point. If clients would like to view participating agencies, that list can be found on our website, ochmis.org, under About and Agencies with Access to HMIS. Please remind clients that they have the right to request in writing the following pieces of information: any corrections to inaccurate or incomplete PPI, a copy of their consent form, a copy of their HMIS record. This information is to be provided within 5 business days of the client's request. The client consent form expires 7 years after their signature or at any time the client chooses to revoke their consent. Orange County COC is required to retain all data stored in HMIS for 7 years after the data was created or last changed. However, data stored in HMIS will no longer be shared in HMIS upon the expiration of the client's consent or revocation of consent. Once the client consent has been collected, it must be added to their record in HMIS. If the client does not have an existing record, please create a new client record. On the record creation screen, find the Release of Information field and set the permission status to Yes. The ROI date auto-populates to the current date. Adjust that to the date of the collection. Note that the end date auto-populates to 7 years. And then at the end, select the method used to collect client consent from the documentation field. Some ROI collection options: electronic for head of household and adults. This prompts the signature field to appear. Client signatures are recorded directly in HMIS via a mouse or signature pad. The ROI should also note any minor children included. Attached PDF. For head of households and adults, upload a signed ROI PDF attachment, and this ROI should also note any minor children included. Verbal for head of households and adults is really just a placeholder. Please only select when not immediately able to collect written or electronic consent from clients. Users must collect wet or electronically signed ROIs at the next in-person meeting. And then the household option, use this option for any minor children included on a head of household's consent form. And both the written and electronically signed consents expire after 7 years. Some information around ROI collection methods for unaccompanied minors. Unaccompanied minors, such as a single client age 17 or under, or a household where all clients are 17 or under, cannot consent to share their personal information in HMIS. Clients served through RI or Runaway and Homeless Youth and HHS, Health and Human Services require parental or guardian consent to share their data in HMIS. And please note, if the client can show proof of emancipation, they can complete the consent without a parent or legal guardian. Without consent to share PPI, the minor's HMIS permission should be set to no, and client privacy must be set to private. Some common ROI errors. If the client record already has an active ROI, you do not need to add another and their consent status has not changed. However, agencies should still review the privacy and consent forms as standard practice during intake. If an agency would still like to add their own signed ROI to the client record, they can do this by adding it under the client files section of the record. And regarding dating the ROI, please enter the date that the ROI was signed, either the past or current date, but never enter a future date. Elizabeth?
So for today's training, we'll be doing all of our demos on our training site, which includes fake client data. So the first step before adding a new client profile is always to search to see if the client has an existing profile. And when you're logging in and you're not on the search screen, go ahead and click the search button to get to this screen. I'm going to search my client. And I can see that there are a few different profiles with a similar name. To verify if these are my clients, I'm going to check the date of birth, the age, and the social security number. And after reviewing from this list, I can verify that these clients do not match the client I'm currently working with. The date of birth, age, and social security does not match. So from here, I know that there's not an existing profile, and I'll go ahead and create a new profile. By clicking the Add Client button, it's going to take me to a screen where I can add a new profile. To save some time, I've already set this up. I've added the client personal identifying information that they provided to me, and I've added that into the screen. And for release of information, we are unable to save this profile until we fill that out. And during the intake, for our example, the client did give consent to share their profile record with other participating agencies. And for documentation, we're going to select PDF. And I'm going to attach the signed consent form. And now that since this is attached, you'll see the Add Record button populate, and now I'm able to save this profile. And by default, this profile is going to be set public, and because the consent is yes for release of information, it's going to be visible by other participating agencies. And to review release of information, we can go to the gear icon to the right. And we can see that the permission release of information is yes. And for client privacy, this profile is currently public. Thank you, Rachel.
Now that we've explored how to add a client's consent form to the record once they do consent, we will now explore available privacy settings for clients who refuse or revoke their consent under Client Record, Privacy, and Sharing Settings. Client Privacy and Record Sharing Overview. Let's quickly review the privacy and sharing setting options available to clients with regard to the visibility of their PPI in the record. Some key terminology to remember are the following. Consent. Clients who consent can have a public record viewable by HMIS participating agencies. Refuse. If a client refuses their consent before or at the time of record creation, the client is expressing that they do not want their record to be shared, and the agency must make the record private so that no PPI is visible beyond their agency. Revoke. Clients may later also revoke their consent, meaning they no longer want their PPI to be shared with other agencies moving forward, and the current agency must take action to privatize or anonymize the record. For further guidance about sharing settings, review the accessing and completing release of information and the refusing, revoking consent to share personal information knowledge base articles. The table seen here may also be helpful for users to understand any required next steps if the client refuses or revokes their consent. We will now explore each of these scenarios. If the client refuses consent during intake or record creation, then during record creation, the user will set the ROI status to be no and make the record private. From then on, only the agency that created the record will be able to view the record. If the client revokes their consent after record creation, then the user will add the revocation of consent to the file and add a new ROI, selecting no, and set the record to private. If the client revokes their consent after record creation and more than one agency has historical data in the record, the user will still add the revocation of a consent to the file and add a new ROI, selecting no, but the agency administrator will then submit a ticket to the help desk requesting the profile be anonymized. And then there's another situation where if the client refuses to provide any PPI during record creation, then during the record creation, the user will set the ROI status to no and toggle the consent refused button. So let's explore each of these scenarios. Privatization at record creation. Note that all client records will default to public even when the ROI status is set to no during record creation. All client records will default to public, as I said, so if a client refuses their consent, then these steps need to be followed to make the record private. First, enter the PPI provided by the client. Then, under the ROI section, where it says permission, select No. Then press Add Record. Navigate to the privacy setting by selecting the shield icon on the upper right corner of the profile screen. And then it's going to take you to the privacy settings for that client. Next to Client Privacy, select Private and save changes. Another important thing to note is that users will see the Consent Refuse button available on the record creation screen. This should only be pressed in cases where the client declines to provide any of their PPI. Do not press that button if the client provides some, but not all their PPI. And do not press that button because the client refuses to sign the consent. For more information about this, see the Creating Client Records Without Identifying Information knowledge base article. Now we'll proceed with a record privatization demo.
As shared, we can enter in PI information that is provided by the client to our agency. The client is informed that we are collecting this information to support with care coordination and to ensure that we're not creating, seeing if they have duplicate profiles. But in cases where the client does not give permission to share their profile, that they want for their profile to only be private, what we will do is enter in the PPI that was collected and provided by the client and submitting selecting the permission to be no. So release of information permissions no. This is indicating that the client did not give consent to share their record with other participating agency. Once you select no, there's going to be the option to click add record. As mentioned, by default, this profile is public, so there is an additional step that we do need to go through to make sure that this profile is private. So pushing or selecting private, go ahead and go to the shield icon, and under privacy, client privacy, select private and click save. By doing so, you'll see now there's a lock icon. That means only the agency that created this client profile can view this profile. Other agency will not be able to search up this client profile. Amy.
Thank you, Elizabeth.
Really quickly, we had a question. Is there ever a situation when you select consent refused?
Yes, thank you for that question. As Amy mentioned, Amy, could we go back to that slide? So for when the client refuses to share any PPI, that is when we select consent refuse. Um, Selecting it on the client profile creation screen is actually going to gray out the fields and not allow us to add any information. So, for example, during intake, if the participant at that time did not feel comfortable sharing their information and did not want to disclose or share any their name, their date of birth, or any information, that's when the client consent refuse toggle should be pushed. And Amy, if you can give me a second, I can get a profile set up really quick to show that example. You'll see this toggle consent refuse. This is only used when the client, as mentioned, is not providing any identifying information. They didn't feel comfortable sharing their social or their name or date of birth. So you go ahead and click refuse, and you'll see that the fields are auto-populated. The social is grayed out. And then we have to set no and add the record and enroll the client into your program to add services. We do encourage over time, as you're working with the client, there may be an opportunity to revisit to see if the client is comfortable with sharing information, and just encouraging them, letting the client know that collecting the information helps with deduplicating profiles and help with care coordination. So again, the client may give consent at a later time, or they'll continue to revoke consent. That is the client's right to let us know if they give consent or not to give consent. So pushing this toggle is only when the client at that moment does not want to disclose any identifying information.
Continuing on, revocation of consent. If a client no longer desires to share their PPI with other agencies moving forward, this is called revoking consent. The client will sign the revocation of consent, and the HMIS user will upload the form to the client record under the Files tab. To find the revocation of consent form, navigate to ochmis.org, HMIS Forms and Documents, HMIS Policy and Privacy Forms, and click on Client Revocation of Consent Form. Once the signed revocation of consent has been added to the record, users will then need to adjust the ROI status and make the record private. Update the sharing settings by clicking on the privacy button, also known as the shield icon, And under privacy, edit the ROI, prior ROI end date to be the date before the new ROI starts. As you can see here in my example, the start date of the previous ROI was 8/5/2025, and the end date automatically populated to 7 years in the future. When I add a new ROI and select no, I'm going to make sure to edit the end date for the previous ROI to be the day before the new ROI starts. As you can see here, 9/1 and 9/2. All right, so once we've done that and added the new ROI, we need to adjust the privacy settings. So next, we will make the record private by finding client privacy and selecting the private button and hitting save changes. Now the record is private, meaning the profile is no longer shared with other HMIS agencies. The agency that created the record, however, can still search up the record, view, and enter their information. So they still have access to all of their historical data. However, if more than one agency has entered data in the record, then the record cannot be made private. As you can see here, it'll populate with this message at the top saying privacy management is authorized to the agency that created the client. If that happens, users will need to add the signed revocation of consent to the client files, then update the ROI section by clicking Add Release of Information and selecting No. And then the agency administrator must contact the HMIS help desk to request a profile anonymization. So to recap, if you ever receive this message, it means that more than one agency has data in the record. You'll need to click the Add Release of Information button to update the ROI status to No. Make sure you're also uploading the signed revocation of consent to the files. And then the agency administrator will submit a help desk ticket requesting profile anonymization. Here's a before and after of an anonymized record. Please note that anonymization does not make the record truly private, but removes PPI from the profile screen. So before, you can see here the client's picture is there, their name, their social, their date of birth. Now it's going to look like this, where the picture has been removed and the first name has been replaced with the UID, and the date of birth only includes the year of their birth, not the month, and their social is no longer visible. Please note for the client that other PPI that was historically in the record, such as under the files, written within any documents of their files, will still remain. So this record is anonymized. It's not still considered a public record, but we are removing the PPI from the profile screen. Other agencies encountering the client in the future will need to create their own private record, and agencies who have been serving the client through this record already will still be able to maintain their access to their record and to continue entering information for the client. Anonymization is also required for clients who do not consent to share their PPI, but also desire access to the coordinated entry system. So if that ever is the case where you encounter a client who says, I don't want to sign this consent, but I want housing through the coordinated entry system, what you'll do is reach out to the help desk to anonymize their profile instead of making it private. If the profile is private, that means only your agency would be able to see that record, and the coordinated entry system administrators would not be able to see the record, and we wouldn't be able to match to that client. Whereas with an anonymized profile, the unique identifier can still show up on the community queue and that participant can still receive a housing match. Please review the Creating Client Records without Client Identifying Information to learn more about this. Now we'll proceed with a record anonymization demo.
Elizabeth, while you're getting set up, the question was if a client prefers certain details to remain confidential, but is it okay with sharing some information? Is anonymization our best route?
Thank you
So
for
they,
that.
Mhm.
Oh, sorry. Go ahead, Diana.
I was going to say to clarify, so they want some information anonymized, but not all.
Yeah, Diana, thank you for that question. I believe it would be case by case. So if you have a little bit more context on the information that is being, the client is okay with sharing and what they don't want to share, you can submit a ticket so we can further review. Anonymizing a profile, as Amy shared, is going to remove their social security, their name, and the date of birth. So those are the fields that would be removed, and if a photo was submitted, if the data elements that they share outside of that is not those identifying fields, then you can share. But I believe it's going to be case by case. So we encourage sending a ticket so that we can further review and get more context around for going over the process of anonymizing files. So in this demo, we're going to view it from the user end. So this client has, in a recent intake, let me know as their case manager that they would like to submit a revoke to consent to share any identifying information. So I'm going to go to the profile of this client and going to navigate to the client privacy, which is the shield icon to the right, and adjusting, updating the release of information. And I do have the form, which I will upload. I'm going to make adjustments to the release of information. First, this is going to be the day before I receive the update. So I'm going to adjust it, making a change that they requested to now set their permission to no. Starting today's date. And it's always best practice to go ahead and go back to the screen, just making sure the information is updated, and going to files and uploading the signed form. And I've already made this update earlier, but you can click add file and you'll have the option of picking the form by default. This is just the first option, and selecting the file to upload. From here, I'm going to submit a ticket to the HMS help desk because I can see under the shield icon, it's going to let me know that the client data is shared with other agency. I don't have the option to click. You can see I don't have the option to make this profile private. So I'm going to go ahead and coordinate with our HMS agency admin to submit a ticket to anonymize this profile.
In the next 5 slides, we're going to take a look at the HMIS client record request. Clients have the right to inspect and obtain a copy of their HMIS record. Clients can submit the request to any agency currently participating in OC-HMIS. Agency admins are responsible for submitting the client record request form within 5 business days of the request. Orange County HMIS recently updated the client record request process. Agencies can now use the client record request form in lieu of a ticket submission. The HMIS Help Desk will upload the client's files to the agency's HMIS Dropbox folder. Users are encouraged to review the client records request knowledge base article for guidance about the updated procedure. At the time of the request, the AA must verify the client's identity and communicate with the client to review the record request process. Please review the client record request knowledge base article. Explain what information can be requested and what each file will contain, And if the client wants a revision to their data, explain which elements of the record can or cannot be revised. At the time of the request, the AA must decide with the client the appropriate method to share this information with the client. The method should not violate the privacy of the client's data. Please schedule a time for the client to pick up the record in office or deliver the record to the client in person. Records can be emailed if they are encrypted or the file is password protected and the client has the knowledge to access the documents. Please avoid snail mail as it is not protected as other methods. Clients may request revisions or updates to data that they contributed to HMIS. This includes information found on the client profile, contact information, client assessment responses, requests to add documents, and revoking their consent to share PPI. Enrollment history, services, and CES status can be shared, but not revised at the client's request. Case notes may be shared at the discretion of the agency. The AA can run the client records request save look under Launchpad, Reports, Data Analysis, Client Record Request, and Client Record Request Case Notes. Elizabeth?
As Rachel shared, the pathway to access this report is going to the launch pad right here. It looks like a waffle icon and clicking the reports icon. From there, you're going to navigate to the data analysis and expand the Orange County Clarity System report and navigate to the client record requests section, and you'll see the client record requests case notes dashboard. So we're going to go ahead and click run. I'm going to pause this really quick so I can add in our client information. So we're going to put in the unique identifier, and I'm going to adjust the agency name to my agency. So the filters at the top, please enter in the appropriate client ID and your agency name so that the report can populate the correct information. As mentioned, we encourage each agency to ensure that they have an internal agency policy around case notes and sharing case notes. It is at the agency's discretion if they would like to share case notes. The first tile is going to have case notes not associated with the program. So this is if case notes are entered directly from the client profile. At the top, there's a notes tab section and program case notes. This is case notes that's within the program enrollment. So you'll see that we do have some example case notes here, and this is the look that we can run to pull the case notes for the client. And you can then click the three dots here and click down the download option to have a copy of this report to share with the clients.
Thank you, Rachel and Elizabeth. We'll go ahead and move on to the next and final portion of our training, which will focus on handling HMIS grievances. Clients should complete the HMIS grievance form if they feel that their privacy and security rights have been violated, or they believe that their security has been compromised in any way. What are considered HMIS grievances? Examples of violations would include the client's HMIS record being shared with someone who is not authorized to access their record, the client being denied access to review their client record as outlined in the HMIS policies and procedures. Please note that the HMIS grievance process is intended to address violations related to HMIS data and should not be used for grievances related to services, which should be handled at the agency level. If possible, the client and agency should attempt to resolve the grievance first. Grievances may be submitted to the OC HMIS team by either of the following methods. Calling the HMIS team at the phone number listed here, or sending the grievance form to the Orange County United Way HMIS department at the address listed on the screen. For grievances related to care provided through the coordinated entry system, contact the Office of Care Coordination at coordinatedentry@ceo.ocgov.com. Users should make clients aware during intake that, if possible, the client and agency should attempt to resolve the grievance first, and that agencies are prohibited from taking retaliatory action against clients for filing a grievance. So sometimes I know that clients may feel a little bit unsure about filing a grievance with the agency first, but we do need that agency to be processed and on file with the agency where the incident occurred before the client completes and submits the grievance form. The HMIS grievance form can be located on the OC HMIS website by going to ochmis.org, HMIS Forms and Documents, HMIS Policy and Privacy Forms, and clicking on HMIS Grievance Form. Agencies should ensure this form is available to clients upon intake and share examples of what is considered a grievance related to HMIS data versus grievances related to services and care. It must be completed by the client and include as much detail as possible in the description box at the bottom of the form. And OCHMIS may contact agencies for resolution steps that require action on the part of the agency. And finally, as we close out this training, we invite users to complete the Client Privacy and Data Ethics Training Survey by clicking on the link available in the Google Doc. Please let us know what aspects of the training we could add to or clarify for your use. Thank you all so much for your attendance. We have now finished the content portion of our training, everyone. Thank you so much. And we're going to open up the webinar to answer the Q&A questions that were submitted through the Q&A box. And then we'll open it up after that to any audience questions. Marlene, thank you so much for your question. To clarify, the grievance would need to be submitted by the client. So the client would not be using our ticketing system. They would need to be submitting the grievance through the 2 channels listed on the form. So that's either by calling the phone number on the form or mailing it in. But again, we ask that the grievance is addressed at the agency level first.
Amy, I just wanted to add regarding any PPI and the ticketing system. When we will occasionally have folks who will include PPI in the ticketing system, requesting help like a user. And we just ask that folks, kind of take a second to think about, what it is that you're sending. We've had some attachments of client information, and we will delete those immediately and respond and create a new ticket letting you know. Please do not do that. But I just wanted to just kind of add that in. Thank you.
To address the second portion of your question, Marlene, I've should be sharing my screen again. You should be able to see the grievance form. On the grievance form here, you can see the language that's used is directed to the participant if they feel that there's been a violation of their rights or they disagree with the decision made about how their information was used. So really the form, even though it can include your case manager or advocate's contact information, it's meant to be submitted by the client. And certainly agencies can assist the client with the process, but it needs to be, submitted by the client. They need to be aware and, have their information listed on the form and explain on their, in their language, in their terms, a description of the grievance. We definitely encourage case managers to be strong advocates for the clients, especially when it comes to concerns about how their data is being used. So I appreciate you doing that. And for your question, because I'm sure there's many others who had the same question, but yes, just to confirm, we want clients, they can receive support and assistance from the agencies, but the clients need to submit the grievance form. They can always call the phone number on the form as well to discuss the grievance process if they have questions too. But again, we want to encourage clients to call that phone number if they have questions about or any questions about the grievance process related to their HMIS data and not for services or coordinated entry system. We'll remain on the call for the next couple of minutes or so in case any other questions come up for the audience. Feel free to use the Q&A or the chat. And if any questions arise after our training today and in between when the meeting materials are made available, feel free to, if you're an agency administrator or you have contact with your agency administrator, to submit a ticket to the help desk. Again, we just encourage folks to complete the survey link attached in the Google Doc with any feedback or questions you might have. Any more pressing or urgent questions, if you're an agency administrator, please submit a help desk ticket or call the help desk. Or if you're a general user, to contact your agency administrator for your questions. And thank you everyone so much for your time today.